She looks like Megamind. Now this beautiful young woman appears to have undergone a fox eye lift, and this is a very common procedure now where you take the corner of the eyelid and you lift it up because for some reason everybody wants their eyes to look like the eyes of a fox. Now this can be done either surgically where you detach the corner of the eyelid and then reattach it into a higher position, or it can be done using threads, which is I think what she had done. And these are sutures with little barbs on them that when you run it underneath the surface of the skin, those barbs will actually attach to the underlying tissues, causing a temporary lift to that part of the face. Now what I think happened to her is she probably had this done and then developed a hematoma, or a bleeding complication on either side. This appears to be more swelling than I would expect just from a minimally invasive procedure like barbed sutures. And what I would expect is that she'll probably get a good amount of bruising afterwards that can last for a few weeks, and that her body will eventually absorb that hematoma, that clotted blood, over the span of a few months. So on this video, I'm going to count down the top 7 botched plastic surgery videos on TikTok. That was number 7. Let's go to number 6. Botox is the #1 most popular cosmetic treatment in the history of the world. And this is a neurotoxin that works by preventing the transmission of nerve impulses to muscle. Now, in order for a muscle to contract, for it to work, it needs the nerve to stimulate that muscle contraction. Botox prevents that from happening so that the muscles don't get that nerve signal and they basically don't contract. And that's why it works well for dynamic wrinkles. Wrinkles that are caused by muscles. And some examples are wrinkles of the glabella or the frown lines, the forehead, and the crow's feet. Now what happened to this beautiful young woman is that she probably had some Botox up in her forehead or up around her eyebrow area, and that Botox most likely spread to the upper eyelid, weakening the levator muscle of the upper eyelid. Therefore, her upper eyelid then does not open all the way and causing that asymmetry that you're seeing. Now the good news is that this is temporary. It will go away within about 3 to 4 months on average. And there is actually an eye drop that we can prescribe that can help that eyelid open up a little bit. It's not going to completely counteract the Botox, but it can help. If you couldn't already tell, this is a buttock implant that basically was back to front and that she moved basically front to back.
Is it worth it? Let me work it. I put my thing down, flip it and reverse it.
Buttock implants are made of solid silicone, and they do have a top surface which is rounder and a bottom surface which is flatter. When the pocket that the buttock implant is in is too big compared to the implant, it can cause that implant to flip like what you're seeing here. So the treatment for something like this is to actually take the buttock implants out, to remove that pocket, or basically cut that scar tissue pocket out, and then to let it heal. She could consider having a new implant placed at a later time, which buttock implants are not my favorite operation because of issues like this. Or she could consider BBL surgery, which is basically fat grafting, where you take fat from the tummy or the thighs or the hips, purify the fat, and then inject it into the buttocks. Or better yet, she can get rid of the implants and just be done with plastic surgery of her butt.
This woman was injected with lip filler and is experiencing a vascular occlusion. Blood flow to the bottom lip is compromised. She needs immediate medical intervention.
So you may look at this and say, oh geez, that's not that bad. It doesn't look terrible. Why would you put this at number 4 compared to number 5, which is a rotating buttock implant? And the reason why is because this is one of the worst complications that can occur with injections of filler. When you inject filler into a part of the face, and that filler is accidentally injected into an artery, it can clog the artery, and any part of the face that is supplied blood by that artery can become ischemic. So in this situation, she has an ischemic lower lip, and if that ischemia is not reversed, the lip will eventually necrose or turn black and die, and she will be missing part of her lower lip. This can also occur when injections are done in the nose for parts of the nose and other parts of the face as well. And the way to prevent this from happening to you if you get injectable fillers, because honestly, fillers are super popular. They're the #2 most popular cosmetic treatment in the United States. is you do three things. First thing is ask your injector to use a hyaluronic acid-based filler like Restylane or Juvederm. Those types of fillers are reversible, and if something like this happens, then it can be reversed and that ischemia basically treated. Second thing is make sure the injector has access to hyaluronidase, and this is the reversal agent that can reverse the ischemia of an injectable filler. And the third thing is to ask your injector to use a cannula. Cannulas are blunt needles that have a lower risk of a vascular occlusion like this because they're blunt. They're made to basically not inject into blood vessels. It doesn't always work, but it can help.
So there was a woman called Hang Myoku, but she was denied further cosmetic treatments due to her unnatural obsession with having silicone fillers in her face. So she ended up taking matters into her own hands and resorted to injecting black market silicone and even cooking oil into her face herself. And afterwards, her face was inflated. You wouldn't believe it. It was like a character out of a horror movie.
All right, now we're getting into the bad ones. Silicone is bad enough, okay? Do not have silicone injected into your face. Any permanent substance like silicone can create infections and nodules and granulomas and lumps in the future. So don't do that. But cooking oil, oh my gosh, cooking oil will create a massive inflammatory response. And the reason why is because this is a biological substance that your body basically is not supposed to have inside of it. And so what will happen then is your body will send all of the different immune response agents, the different white blood cells and all of that to attack it, causing all of this damage that you're seeing in her face. Unfortunately, the only way to treat this would be to cut that cooking oil out of her face, but most likely it's injected kind of all over the place, and so it is a really, really, really difficult situation. So we're down to number 2. How bad can it get with botched plastic surgery? This has got to be worse than cooking oil in the face. Did you see that? Okay, let's show a picture of this woman. Oh my gosh, after all this stuff was done. And you can see that it looks like her nose has been completely amputated. It's just 2 holes in the middle of her face, and her lips are incredibly, incredibly large. Is this real? That's the big question. And the answer is a lot of people thought it was real, but this is actually a mask. Could you believe if this was real? I don't know who would be doing these operations, but yeah, thank God that this is a mask and is not a real person. But there is a number 1 on this list of botched plastic surgery, and it deserves to be number 1. Let's take a look at it. Okay, I don't know why plastic surgeons show these videos. As scary as they are, I don't see them attracting that many patients by showing this type of thing. So this is called the Spidey lift, or this is what they call it, the Spidey lift, where they take these sutures and create what's called a hemostatic net. There are 2 reasons why they do this. In some patients who have actual facelifts, they will take these sutures and run them along the skin, overlying where they lifted the skin for a facelift, and the idea is that it can help lower the risk of bleeding complications. Well, I do a lot of facelifts, and I don't have a lot of bleeding complications because of how I do the operation and because we use something called TXA. And this is a very inexpensive medication that we can spray on the inside when we lift the skin to lower the risk of bleeding. But what they're doing here is they're using sutures to actually go through to close off that skin that's been lifted up so that it doesn't bleed underneath. Those sutures are typically removed several days later, hopefully before they leave track marks all over her face. Now, the other reason why they do this, and I don't think this works, is because some of them believe that if you put these sutures in the face, it will cause the skin to tighten up underneath. I don't get it. I've never seen any proof that this works. And as you can see, it is absolutely horrifying. So I do think that this deserves to be number 1 on the list of botched plastic surgery TikToks. But there's one other video left that's somehow here. Let's take a Dang, Dr. Ricky Brown. So these are some pretty extreme botched plastic surgery TikToks, but what do you think about a woman who has literally 2 of the largest breast implants ever and one of them pops? Yes, this happened to a huge influencer, and I react on her TikTok video right up here. Check it out. And remember, eat real food, use clean skincare, and auto-juvenate before you operate.